part of our problem here in the state of Alaska has been the reimbursement issues, and I think we recognize that as long as we continue to have reimbursement at effectively 1/3 of what it costs the providers, we're going to have an imbalance. We're going to have people that when they hit 65, they're going to be told, okay, you're now Medicare eligible. You're basically given the bus ticket, but there's no bus that ever shows up because there is nothing to access. There's no provider that we have. You'll recall last year at this time, the discussion that we were all engaged in was healthcare and healthcare reform, what was going to happen with the ACA. The ACA is still in place. There have been parts of it that have been pared back, but many of the protections that I support, such as ensuring that those with pre-existing conditions remain covered, that young people up to the age of 26 can remain on their families' policies, these still remain in place. But we still have a great deal of work to do to reform health care and access to care in the state of Alaska. Just saw an article this weekend saying that the one provider that we have for the individual plans in the state is saying, well, they think that the increases are maybe we've seen the end of those for a period of time, but we have not quote solved health care and access to affordable care yet. We got a long ways to go. We've actually been working on some, I think, helpful provisions here in the Senate as they relate to the cost of prescription drugs, efforts to deal with the issues related to behavioral health and mental health, as we're seeing the impacts from the opioid crisis that has hit our state as it has hit other states. So the work is ongoing. I think that is important for you to recognize, that just because it's not in the headlines doesn't mean that we're not taking this on front and center.